I was growing up in a really violent household that started about the time I was 4. There was heavy drug and alcohol use present, and this was an ancestral pattern. It had existed for many generations, and it was an experience that was largely kept secret. There's a lot of complicated shame and guilt that is associated with early developmental abuse and mistreatment. There were also a lot of signs along the way. There were neighbors who saw things and turned and looked the other way. There were friends who saw things and turned and looked the other way. There were people who didn't know how to get involved. Even if they were curious, even if they cared, they didn't feel empowered to reach across the divide and do anything.
Northern Lights is a children's advocacy center. They are one-stop shops for survivors of physical and sexual abuse, neglect, human trafficking, even witness to violence. What that means is that when children come to us, they are able to start healing rather than having to relive their trauma again and again by retelling their story.
A lot of the families that we're working with, they're going through really unimaginable circumstances where there's a lot of pain and fear, and we have to do our job as advocates to be there for them through that process in a way that gets the best case outcomes. I'll talk with the family and help them prepare for what the forensic interview looks like, and I am the one that welcomes them to the center, and I take them to our family advocate waiting room, and I walk them through exactly what they can expect for the forensic interview.
It's great when we get to meet them and talk with them before going into the interview room. You can see them look around and see the toys and books, that it's a really child-friendly place. And when we get into the interview space, assuring them you're not in trouble with me, we're just here to talk. You can see them getting that relief just from telling someone and being believed.
Forensic interviews are child-centered. They're non-biased, they're fact-finding. Really, my job as a forensic interviewer is to listen and to create a space for a child to talk.
I'll typically get a phone call and coordinate a forensic interview with the child and the family, as well as the investigators. And then when the family comes to our center, I will be in a separate room with, again, the folks on our multidisciplinary team, observing the interview, being the second set of eyes for the interviewer, and just make sure that everybody's working together collaboratively and improving outcomes for the families.
Every time a child needs to recount what happened, they're being re-traumatized. They're having to relive what happened. They're having to kind of sit in those emotions. And when you have to retell a story multiple times, you kind of don't know when that's going to end. With our center, the hope is that they come, they tell the story one time, and they know that that's the end of them having to tell it in the course of the investigation.
When your abuser or perpetuator of violence is someone that's a figure of authority, it can be very intimidating to then have to seek help from another authority figure. And so decoupling power and authority from the person that you're seeking to get advocacy and help from, that's disarming to my nervous system. I feel safe, I feel seen, I feel like I can speak freely. That's not quite the case for a fully uniformed officer.
That's the last thing we want to do, is bring more stress onto them, which that's unfortunately happened for years here in Marquette County without having a center like this. So it was just kind of it just wasn't an ideal place to do these type of interviews. The center is a huge asset. They have done a wonderful job down there getting it up and running. We in law enforcement, it's just been a huge asset to us. It's just a wonderful place. The people down there working and the people doing the interviews just do a wonderful, great job with the kids. And it's just, I believe it's made a huge difference and will continue to make difference in the interviews and the process that we do in Marquette County when we get these type of complaints with small children.
Superior Health Foundation recognized that this work is extremely critical, and the uniqueness of the services that can be provided by a children's advocacy center that aren't available anywhere else. So without one in the Marquette community and without CACs in the Upper Peninsula, we're underserving our children, and specifically the most vulnerable children who have already been subjected to the unthinkable.
In regards to the grant that the Superior Health Foundation awarded us for an upgrade to our audio and visual equipment for the recording, that's been a tremendous help. Sometimes when we do forensic interviews with children, they talk in a low voice. Sometimes, their hands are over their face. Sometimes they're crying, and it's difficult to pick up on some words they say during those interviews, which can be a problem when the case goes to court. So having the professional equipment that Superior Health Foundation granted has been a tremendous help, and it's going to ultimately help hold more people accountable for abusing children.
I feel like it's really hard to get our message out to people and talk about the work that we do because initially people are met with that first feeling of, I don't want to talk about that. It's either the denial of that doesn't happen in our community or it doesn't happen to the people that I know and love. So having this feels really great, and I'm really thankful to Superior Health Foundation and to you guys for being able to help spread our message to people about how important it is that we stand up and we be there for people who are going through that.
We're talking about an issue that can be quite invisible, especially in a rural environment. First, raising awareness is an important starting point. And having people honor and commit to the value that we owe it to our children. If during my experiences of violence in my childhood, Northern Lights Child Advocacy Center existed and was accessible to me, it would have kickstarted my path to healing and wellness. I would have felt supported. It would have also empowered the other people in my life to access resources that largely felt outside of their scope of understanding. To have this face on it, where it's cozy, there's snacks, there's food, there's security, and there's kind faces, it's more than a trifecta. That's the whole ecosystem to allowing children to feel like they can open up. And if children feel safe to tell the truth, then there is room for progress forward.